bioethics has always been, and as a clinician, especially working in this part of the world, it's always been something that you're faced with on a day-to-day basis. Like, what is equality versus equity? When you have one ventilator and three children that need a ventilator, how do you make that decision? But what really drove me finally to do bioethics, because it's something I've been putting aside for a really long time, but what really drove me finally to do it was not the everyday clinic work where we have to sort of make decisions on who deserves the oxygen when it's just one pot that exists. It was driven by all the work that we are doing at Yamachi, the genomic work. Now, again, because the African genome has not been fully studied, most of the results that come from the tests that we do, and this is not Yamachi, like even on the clinic side, we do for patients comes out as maybe variant of unknown significance. The question is, I mean, it's a variant of unknown significance because it's not been fully studied. And then one time you might have a genomic test that tends a poor prognosis for that patient, or one that means that they need to do a yearly MRI, and you're sitting there and you know that everything is out of pocket. How do you even tell this family that they need to do this? Do you need to communicate that result to them? Do you even need to test them? Like, what is the end goal of all of this? Because, yeah, it's interesting for a scientist. We want to understand, but then how does it affect to that one family, that one patient at the end of the day? So that was really what drove me to bioethics at the end of the day. And I had this one child who we had sent a sample abroad, and it came back to be a syndrome that, I mean, it got me excited as a clinician. I'm like, yeah, I thought about it. It means I was right. But then just when that joy about being a clinician settled down, I'm like, yay, it means he needs yearly MRIs. It means he needs this screening and that screening. It means he's at risk of cancers. But what are we going to do in this part of the world? How do I even tell the parents? Does it mean that it's a child that they would sort of close their eyes to because this child is going to cause them so and so? And so, I mean, at the end of the day, really, that was what drove me to bioethics. And I'll be happy if I'm able to answer the other questions of equity versus equality and justice and autonomy when a patient decides to, when you say the patient has autonomy and they decide that you should make the decision for them. It's their autonomy, like it's their right for them to decide who should make the decision. But as a clinician, you're like, nah, I don't want to make the decision. But the patient thinks they are okay for you to make the decision. I have a lot of questions to ask, and I'm hoping, I know I will not get all the answers, but I know it would potentially help me navigate some of these situations.